Hi everyone, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about a very asked topic, both on my Instagram, on my TikTok, and even on this channel. And it's about ways to increase your breast milk supply. All right, so before we talk about what could increase your milk supply, I think it's really important to talk about what could impact your milk supply to bring it down. And it's first and foremost important to talk about it because if you're doing any of these things, it's helpful if you would go ahead and stop or at least talk to your doctor about it so that we can make plans about how to help you to get your milk supply in the right place it needs to be. So some things that we know can affect milk supply. Smoking. Generally, smoking is just not beneficial for your health. It can be detrimental to your health, and it can also increase the risk of SIDS for babies. So you want to try to stop smoking or stop exposure, especially even secondhand exposure to a smoking environment. Other things that can potentially impact your milk supply but might be helpful for you to be taking for some reason, for your health reasons, would be antihistamines. So these would be things like Benadryl or like Zyrtec, but of course, parents have allergies. I think it's important that this is a conversation you have with your doctor about if this is something that you need to take every day, or is this something that you can look at other medications that may not potentially impact your milk supply but still help with your symptoms. But it is helpful to know. I mean, things even like Sudafed we know can impact your milk supply. So definitely have these discussions with your doctor. If it is something you have to take, let's say you have a sinus infection or it's allergy season, is it something that we can decrease the duration you're taking and not necessarily taking these medicines every day? The next medication would be oral contraceptive pills or birth control pills. Now, OBGYNs are very familiar with this. So if we are recommending that you take birth control after delivering your baby, or you need to take birth control for health reasons, there are medications that you can take. So progesterone only medications that you can still take as an oral contraceptive that wouldn't impact your milk supply. So now that we've talked about those most common medications, there are of course others, but in the scope of this discussion, I just wanted to talk about the most commonly used medications that we see. Let's talk about 5 tips that can help to increase your milk supply. So tip 1 is going to be frequent milk removal. You are going to hear this from me over and over and over again. If you've seen my videos on TikTok or on Instagram, frequent milk removal is the name of the game when it comes to increasing your milk supply and trying to match it to baby's demand. You see, breastfeeding is a supply and demand situation. So the more demand your breast sense, the more signals they send to your brain to then increase milk supply. So frequent milk removal is very helpful to help meet the supply that you need to have for your baby. Second tip, skin to skin. Now we've talked about this before, but skin to skin has many benefits, not just for the baby, but also for the mom. Because we're specifically talking about increasing your milk supply, there's evidence that shows that skin to skin time can actually increase breastfeeding duration, but also breastfeeding success. We also know that it can release oxytocin, which is a hormone involved in release of breast milk, and generally not only lower baby stress levels, but also mothers as well. Anxiety, stress is going to be one of those things that does impact milk supply and milk release and letdown. So if you can do something that combats that, something as simple as skin to skin, I highly recommend it. That's why it's actually one of the things that we support and promote in the very first few hours of life for baby. Okay, so my third tip is actually switching breasts. So the reason I recommend this is because, again, it goes back to frequent milk removal. So if your child gets to a point on, let's say, the left breast where the milk is starting to slow down, you would switch to the right breast. Then your child gets to that point on the right breast, switch it back to the left. You see, you're giving your breasts enough time to, again, sense, regulate that milk supply is low, and then the demand is right there. Switching breasts is actually very sort of akin to what we call power pumping, if you will. And many exclusive pumpers might be familiar with that phrase. But power pumping, for example, is actually 20 minutes of pumping, 10 minutes of rest, 10 minutes of pumping, 10 minutes of rest, 10 minutes of pumping. And you're sort of mimicking cluster feeding. So by switching breasts, you're allowing your breasts to get the signal of frequent milk removal, giving them time to sense that, and then put baby back to the breast. You get a vigorous suck from the baby. The breast then can respond with, again, producing milk. Especially if you do this over a couple of days, you will start to see that, yes, your milk supply should increase. The fourth tip is breast compressions. Maybe you haven't heard of this before, but it can be very helpful for some women. Breast compressions while baby is nursing can actually be very helpful. It can turn like the nibbles and the sucks to good long drinks for baby. It provides compression against the breast. And sometimes if you have the perfect latch, which we'll discuss in a minute, the chin, actually, if it's pointed toward the breast, is actually providing some kind of breast compression as well. So this is also something I highly recommend. Breast compressions can definitely help to increase milk supply for the baby by actually activating and promoting a milk letdown. All right, so the 5th tip we just recently hit on, the latch. So having the perfect latch is so important. I know I've discussed this to almost ad nauseum before in other videos, which I will link right here, but the latch is so important because if your baby's latch is not right, they are not removing as much milk as they potentially could be. And then you go back to tip 1, because again, having frequent milk removal is an important factor in making enough milk for the baby. I know that a lot of people come to this video to hear what kind of herbs and supplements I recommend, and I'm gonna say this once because I know people want to hear it, but I will also give this very important disclaimer that this is one of the last things I recommend. I don't really like herbs and supplements for a couple of reasons. One, people think that if I just take or eat something, it's just gonna make everything so much easier. Well, it's not as simple as just taking one single pill, and I kind of treat these as medications in some way because yes, they can actually have effects on your body. So some of the common supplements that are recommended would be fenugreek, goat's rue, moringa capsules, shatavari is another one. And some of these, I think it's really important because people don't really know how much to take and how much is actually beneficial. Also, we don't know how much might potentially be not beneficial and could be detrimental. So for example, fenugreek, you actually have to take a pretty decent amount of them. It's not just one tablet. Usually you have to take about 4 to 5 tablets, depending on what the dosage is in a fenugreek capsule, to actually meet the appropriate amount. One good way of knowing that you're actually hitting the right amount is your sweat, your urine can start to smell like maple syrup. It's not exactly very pleasant. It can make moms really gassy. It can make babies really gassy. And whereas one end you're trying to chase a low supply, you might end up with another problem with a very gassy, irritable baby. So I'm not a huge fan of fenugreek for that reason. Other supplements that I just recommended, again, I'm not a fan of because they can interact with things like blood thinners. They can also affect your blood glucose. So I think it's really important to treat these like medications and not just take supplements without really thinking about what you're doing. Again, if you haven't maximized those first 5 tips that I discussed, then I wouldn't necessarily jump to doing herb supplements. Lastly, I know parents are going to question then how do you know that your child's getting enough? Well, it has nothing to do with how frequently your child's nursing. It has nothing to do with the hunger signals per se. Children sometimes can cluster nurse and be hungry after 1 hour. Sometimes your child needs to be brought to the breast every 1 to 2 hours. I know in the hospital they say 20 minutes per breast every 3 hours, but children don't come with handbooks and they don't necessarily always go by the clock. Children are dynamic. Babies sometimes need to be fed more frequently. So as pediatricians, how do we objectively know that you have enough milk if you are exclusively nursing your baby? Well, we look at the scale. Okay, we're able to identify objective weight gain. We're also able to see if your child is meeting appropriate milestones because that shows that your child is getting enough nutrients to remain alert, active, and thrive. Now, as a parent, what can you do? Well, oftentimes we'll discuss the number of wet diapers that the baby's had. That shows you that the baby's getting enough hydration in the way of breast milk. We'll also discuss stools. So especially in the beginning, if we have an idea if the stools are transitioning away from that tarry black meconium substance, we have an idea that you are getting enough breast milk moving through the GI tract to be able to, yes, produce enough stools, stool out their bilirubin, remove their jaundice, and we know that baby is getting enough hydration. All right, I hope this was helpful. If you have any questions, please ask them below. If you would like to, make sure you give this video a thumbs up, share it with another mom or a mom-to-be, and tune in next time for another video. Thanks.